The more prevalent autism becomes, or the more that it's diagnosed, we need to recognize that kids and adults have special needs, and they're all very unique in their own way. They have different ways of communicating. They have different ways of dealing with things that maybe others don't. They don't quite know how to perceive what someone is saying to them, so they may react in a way that we're not used to. And I think the more aware of that we can be and learn about them and prepare for their visits, the less traumatic it is for their parent or caregiver, and the easier it is for the staff to provide them the care that they need. I think we're very fortunate that we have our own public health department through the hospital, and that collaboration between us gets that care rolling sooner. It starts in the home. They're able to share information that helps us treat the patient in an emergency need. And I think the more education and the more knowledge we can bring to these kids about what to expect, the easier that the whole transition is between public health, primary care providers, emergency department visits. Your Guide to Emergency Care. We started this with children with autism in mind. We would also use this for any child that this would benefit. So although it was started for autism, we do have it open to anyone that we feel that would benefit from this. What we wanted to do is we wanted to take that child when they were in a good situation, and it was a planned thing to come in and basically do a pre-visit. So if they ever come in a bad situation, it's not all new to them. What we do is we set up a time with parents. We do a little pre-visit checklist, learn as much about that child as we can. We can tailor this visit directly to what the parent feels would be most beneficial for the child. They would have the opportunity to tour the ambulance. We would walk them through what an emergency room visit could look like. We would look at the waiting room, we'd look at the registration room, we would bring them into an actual patient room and let them touch all of the things, you know, play with the blood pressure cuff machine, get their blood pressure checked, their temperature checked, but also kind of expose them to some of the smells. If the situation warranted, we would also take them back to the radiology department, let them see what the CT scanner looks like, or if they had to have an x-ray, what that would look like, and just slow it all down. Let them ask questions, let them get comfortable and familiarized with those things. They'd get to meet a doctor, you know, play with a stethoscope, just kind of get to know us a little bit while we get to know them. Bit of Grace puts together stim kits. It is a backpack with several different things in it. There are earmuffs for children or individuals who are sensitive to different noises. There's different communication tools in there. Emergency care is a lot different than, say, like a primary care visit, because we are doing things at a different priority level. So if you're coming to the emergency department, you're typically in some sort of crisis. And those are times where we need to act fast. And that is one big barrier with autistic children, is that the faster you go, the more traumatizing it is to them. So that's why this program is so important. If they're familiar with something, they're not going to be as triggered when we're maybe moving at a higher rate of speed to get things done. This is open to any child or young adult that this would benefit. And if there were others in the community with special needs that this would benefit, even if it was an adult, I would hope that they would reach out to us so we could establish that for them as well. Well, I think this program would be a huge support for those that choose to partake in it. I do know there are some community resources, some different support groups that parents can attend if they have a child that maybe they just need a little bit of relief, like someone else to step in and be the caregiver. That's when respite would come into play, and we would contact our local public health department to help us assist in setting that up and finding the family the resources that they need. We also have an excellent discharge planner or case manager here at the hospital that has some of those additional resources. We would also lean on county social services to help us find those if we needed them, but there is help out there for families that just need some additional assistance. For us, just establishing a patient care plan specific to them that could follow them potentially not only in ER, but if they were to see a primary care physician, that we could have that collaboration with other teams to make smooth transitions between the two so we can care for them the best that we can.